All right, hey guys, welcome back for lesson 2 of the root cause revolution. This lesson is problems with functional medicine, and they are rampant. And I want to protect you guys. My role here, my goal here is to save you time, energy, money, heartache, and just make your life easier. Like the role of real medicine and real health is to make your life better, not more complicated. So, with that being said, let's dive on in. So, this lesson, we're going to talk about obviously problems with functional medicine. And that functional medicine at its core is a holistic approach that uses a root cause way of thinking. So, we're looking for the underlying causes of disease or dis-ease. The body is not at ease, right? So the purpose of this lesson is to address some of the common issues and challenges faced by individuals using mainstream functional medicine. So the roadmap of a typical functional medicine client experience. This is how it normally goes. You book your initial appointment, go over your health history, they get to know you, all that good stuff, like that's necessary. But then immediately you move into expensive lab testing. And then you got to wait weeks for the result. Then you receive the lab tests and you begin your first protocol, which is usually anywhere from 15 or more supplements just for that protocol of whatever that problem is, whatever is being addressed at that point in time. Then you have repeat visits, you have a complete, or oftentimes a lack of follow-up to see how you're doing. And more often than not, I would say more than 75% of the time, you're only going to experience a slight improvement at best because we're using the wrong approach. But then they're just going to start you on the next protocol when you're finished with the first protocol. So and then the whole thing repeats. So you go, you kind of start from square one and say, okay, well, it wasn't that protocol, but it must be the next protocol. And then it's just protocol after protocol after protocol. Do you see how this is no different than a pill for every ill type mindset? It's not a protocol for every ill, okay? You don't need to do all of this overly complex, overly expensive, digging through the weeds type of approach. It's the wrong way for the human body to heal. It doesn't even really make sense when you learn to look at it from a certain perspective, and that's what I'm trying to invite you in on. So, the expensive and often unnecessary lab testing. You can expect at a minimum to spend around $1,500 on labs alone. That's it. This is what I was taught to do, to sell you labs, and then we'll go over all the labs and we'll give you this perfect protocol, and wow, it sounds amazing. And guys, in theory, it is amazing. In theory. But the thing is that too many labs can cause total overwhelm and confusion. You have no idea what's going on. It leads to a so many things are wrong with me type mindset. And often this leads to people getting completely overwhelmed and giving up. How is that helping anybody? And then the labs lead to complex protocols where you have to learn everything that's going on. You got to take high doses of these nutraceutical supplements, and it's a protocol approach. So we'll do a parasite protocol, we'll do a detox protocol, we'll do a SIBO protocol, candida, adrenal, thyroid, gut. It just goes on and on. There's a protocol for everything. And at the end of the day, you often have to cycle through protocols, repeat protocols, and just keep on spending money seeking the end. Like, when does it ever end? Well, the answer is it really doesn't, because it's not focusing on the things that we need to focus on. So the need now is for simpler and more practical approaches that don't drive you nuts. Okay, so let's talk about types of labs. And guys, don't get me wrong when I'm talking about labs here. This is cool stuff. Like, you can find out everything you could possibly ever want to find out about what's going on inside your body. But it turns out that more information is actually less helpful than you would think. So there's hair testing. It's called a hair tissue mineral analysis. And here's a picture of it right over on the right side here. And it shows the mineral levels in your body. It also can show toxic metals like mercury, aluminum, lead. Whoop, misspelled mercury there. And all kinds of other toxic elements. And this can be a really good test, but it's often utilized incorrectly. And this is the central component of this lesson. The central core take-home principle of this lesson is you can do all the labs in the world, but what are you going to do about the labs? That's what matters. Sure, you can collect data and you can get all kinds of cool info, but what do you do about it? Because oftentimes practitioners who utilize this lab are not utilizing it correctly. What they're doing is saying, because this lab, if you look over here, look in this purple section, this is just a simple bar graph, right? And so you can see, oh, you're low in sodium, you're low in calcium, you're high in magnesium, you're low in copper or zinc. So here's what I'm going to do. I'm going to give you a calcium supplement, a magnesium supplement, a zinc supplement, a copper supplement, or maybe a combination. And we're just going to try to push all those levels up. And the thing is, it doesn't really work. You can retest and show that it doesn't really work because that's not how the body operates. The body does not like synthetic, isolated supplements, especially minerals. And now people are using like nano mineral supplements, meaning the size of the mineral is extremely small, so small that it's 100% absorbed. But the problem is you don't need nano supplements that are overriding your body's ability to manage itself and balance itself. That's, again, it's still forcing the body. It's still telling the body, I want you to do this, and I'm going to make you do this because I'm smarter than you, and I'm going to make you do what I want to do because I know. Well, no one knows more than your body. Your body knows more than any practitioner, including myself. So there are all kinds of problems with this test if you're not working with the right type of practitioner who actually knows how to use this test. And that in itself takes months to properly learn and implement. So again, this is just basically a waste of money and it's over complicating what's the picture that needs to be painted. It's much more simple. Food sensitivity testing can be very popular, reveals potential problem foods, but it leads to a very strict diet that's difficult to adhere to. So I know this picture is kind of blurry, but this is what the results will look like for you. And you'll see that there's green, yellow, and red on each food listed. And when the dark line is all the way to the red, we know that it's a problem food. If it's to the yellow, we know that it's probably causing issues as well. And it, again, leads to this individualized but highly strict diet that you must adhere to. And then you have to constantly try to reintroduce foods one at a time every 6 weeks and see if there's a reaction. Do you have time for that? I don't have time for that, and I don't have the brain power for that, especially not when I was feeling very unwell. Okay, like the issue, again, at the core of it is stress. So if we're causing you more stress, thinking about all the things that you cannot eat because they're problems, is that going to help? So this test is essentially useless because it's not the foods necessarily that are the problem. The problem is with an overburdened immune system, not the foods themselves. This is a test that is reflecting the function of your immune system. Because if you remember, or if you didn't know, 70% of your immune system is in your gut. So if we're having all kinds of reactions to foods, we know that we have an immune system problem, which is not a food problem, right? It's an immune system and gut problem. So as with all tests, what we're going to do about the results is what matters. It's not the results themselves. It's what we're going to do about them. So this test is expensive and oftentimes completely useless because you're not going to adhere to it anyway. And the protocol to fix it is not actually fixing anything. You're just avoiding foods all the time. Next up, we have the organic acids test. This is a test for gut health. It's a urine test, and it reveals all kinds of cool stuff. This is actually a good test, but again, it's misinterpreted and it's misutilized. The protocols that result, what we do about the results, are not actually addressing the core problem because the core problem is not being properly identified. So this test reveals your B vitamin levels, your mitochondrial health and function, your gut bacteria, and if you have an imbalance in your gut bacteria, which is called a dysbiosis, it can show candida overgrowth and exposure to mold and mycotoxins. These are all great things. But again, what are we going to do about them? People who use this test often lead to harsh protocols that often cause more problems than they solve. They cause constipation, fatigue, malaise, headaches, migraines, nausea, vomiting, diarrhea, gut irritation, pain, and further inflammation. So the lab and the protocol very often needs to be repeated multiple times, leading to wasted time, money, effort, and energy. Let's say you have SIBO, small intestine bacterial overgrowth. This test can show why. This test can show that it's there. But the protocol that comes with it is often, oh, this is too high, I need to knock it down. Or this is too low, I need to replace it. That is not what this lab is ultimately revealing. What this lab really shows is toxins. Our protocol must effectively and gently remove the toxins to produce meaningful results. Because we need to be able to grab on and remove the mold or mycotoxins. We need to be able to remove the underlying reasons why you have candida overgrowth or why you have gut bacteria dysbiosis, which is oftentimes caused by parasites, heavy metals, environmental toxins like pesticides and herbicides. The bacteria is not the problem. Okay? It is the underlying terrain, the environment of the body that is actually the problem and is why bacteria and all these other things are showing up in the first place. Here's the thing that's mind-blowing. Those things are there to help you break down toxins. So if you don't get rid of the toxin, you'll never get rid of your SIBO, you'll never get rid of your candida, you'll never improve your mitochondrial health and you'll never recover your B vitamin levels. So our protocol must include the removal of the toxins that are causing the bacterial overgrowth and the invaders, right? Because we call them invaders, but they're really coming in to help you and to break down and remove toxins. This is where most people are completely missing the boat. Again, next we have stool testing. Stool testing can reveal parasites and H. pylori, which is a bacteria that can cause low stomach acid and other issues. Candida, again. But the problem with this, number one, is you're reaching into your toilet and collecting stool, which is gross. You need to collect 3 different samples, and it still often misses parasites, which can also be systemic. Parasites don't have to be limited to your gut. They can be in other parts of your body. And then again, this mentality, this testing leads to harsh protocols that chase bugs rather than removing the toxins that the bugs are there to help with. It's a hunt and kill mentality. This is not the mentality that leads to healing. You can hunt and kill until the cows come home for the rest of your life, and you won't make meaningful and lasting improvements in your health because you haven't gotten rid of the true problem, which is the toxin. Some other commonly used labs are things like the GI map, the Dutch test, specialty blood tests, things like a wheat zoomer, which can show gluten sensitivity and all kinds of stuff. But again, these tests often miss the mark and lead to protocols that are more of a band-aid. So the question again, what are we going to do about the results? So moving on to more problems with functional medicine. These protocols have an overemphasis on supplements. They place a complete reliance on numerous supplements, often 20, 30, or even 50 plus supplements, multiple times a day, every single day. Does that sound cost effective? There's potential for interactions and side effects, the high cost of supplements, again, and then the wrong supplements mean wasted money and expensive urine. The isolated nutritive supplements made in China and marked up at ridiculous prices are still a band-aid and not actually addressing the root cause. Complex and time-consuming protocols. The protocols can be overly complicated and difficult to follow and painful, causing harsh detox reactions and making you feel worse. How does that help? Patients may feel, overwhelmed and give up on treatment. We need simpler, more practical approaches that accurately and effectively address the root cause. There's a lack of standardization. There's completely inconsistent practices amongst practitioners. And there's a variation in the quality and effectiveness of treatments. So, one protocol, you may do the same test and have a different protocol with a different doctor. And this causes confusion and frustration for clients who are seeking reliable care. Because again, most people are not looking, they're looking way over there when they need to be looking over here. How can you do anything right if you're looking in the wrong direction in the first place? Insufficient focus on root cause. Sometimes the approach may still not fully address the underlying root causes of health issues. And this leads to symptomatic treatment rather than true resolution. This is the importance of a holistic approach. Most functional medicine is nothing more than lab and supplement dispensaries. That's what it has evolved into. There's problems with access and availability. Functional medicine practitioners may not be easily accessible to everyone. There's limited availability in certain areas. There's a high cost of consultations compared to conventional medicine because oftentimes functional medicine is not covered by insurance. Now, there's some caveats there because insurance at the end of the day is only going to pay for drugs and surgery. That's it. So if you don't want to use drugs and surgery, you can't use insurance. I know that that's completely unfair, but that's what we're looking at in the current state of affairs right now. Things look like they may be changing, but ultimately, if you're looking for an alternative approach, that's just the way it is at the moment. You must visit the office or clinic and take time out of your day. You got to get in your car. You got to take care of your kids. Or bring them with you. You got to coordinate with your spouse. You got to do all kinds of stuff and manage to get some time off work to get to the office or clinic. There is the problem of overdiagnosis, which comes from too many laboratory tests. So there's a risk of diagnosing conditions that may not significantly impact your health. So we can dive in and look around and look at what's going on in the body, but it may not really be impacting your health and having a significant impact on where you're at and your actual feeling of health. So do you really need an endless list of what's wrong with you? Is that going to help you? Anxiety and stress for clients receiving multiple diagnoses. So I don't diagnose, okay? Just to be very clear, I do not diagnose, but because I'm not a doctor and people who work with me are not patients, they're clients. But getting multiple diagnoses is oftentimes making things far worse because now you're ruminating on, oh, I've got this and that, and this is who I am now. I am this diagnosis. You are not your diagnosis. I don't care what it is. And these diagnoses make things overcomplicated. So they lead to they're completely unnecessary and often ineffective. Now, it may help you at least not feel like you're all up in your head, right? By getting a diagnosis. And I'm not telling you that you're all up in your head. But to pursue endless diagnostics is insane because you're doing the same thing over and over again, expecting a different result. It's just not going to happen. You need to stop chasing diagnoses and start effectively addressing the root cause. There's a significant time commitment as well with most functional medicine. You got to do your follow-up appointments. And again, you got to go to the clinic. You got to do all this stuff. You got to take your 50 plus supplements. You got to do your repeat labs. You got to pay for your further consults. And people are spending upwards of $100,000 chasing their health. And they're still coming up empty-handed. And they're seeing the best people everywhere. But is it the best people if they're still, again, looking down the wrong path? How can you make the right choice looking down the wrong path? So we need more flexible and time-efficient options. This is why I'm completely online. You don't have to go anywhere. You can take a 30-minute lunch break if you're at work, and you can talk to me. And, It's fantastic. So you don't have to go anywhere. You can do it from the comfort of your own home. And it's basically equivalent to going to the clinic, except it's way less of a pain. So, in conclusion, the main problems with mainstream functional medicine today: too many tests that lead to overwhelm and burnout, too many protocols that are not holistic enough and are only focusing on one problem in the body, whereas a truly holistic approach understands that everything that's happening in the body is influencing everything else in the body. So what are the actual things that we need to address to make improvements in health and to reclaim your energy and vitality and resolve these issues for good without being dependent on endless supplement protocols for the rest of your life and just cycling through? This is just completely unnecessarily expensive. Now, investing in your health is completely worth it, but $20,000, $30,000, $50,000, $100,000, that's absolute insanity. And it's completely missing the mark. The whole goal here is to help you reclaim your health in every way. That means your energy, your sense of well-being, your purpose, your finances. Like, I'm not here to, well, first of all, I'm here to educate you, and that's it. If you want help, but I'm also here to help you implement if you want to take that step. But my goal is not to put you at a complete financial, put you into debt, chasing your health and making me money. I could not live with myself like that. And maybe that's just who I am as a nurse, because that's what I feel like in the hospital, right? Where we're not truly helping people. So I embarked on this mission to truly help people. And then I started learning about all of the issues in this space and how you're still being lied to or misled. And some of these people may have the best of intentions. Most of them do. But it's just way too egotistical. It's way up in the mind. And it says, I know I'm so smart. I've figured everything out. I know how the body works. Take this stuff and you're going to feel better. You may feel better, but for how long? And as soon as you stop taking the stuff, do you fall back to where you were? So we need to address the real issues effectively, because preventative care is still extremely important. It is the most important thing you could possibly think of, in my estimation, when it comes to health, because your health is your wealth. I promise you. Everybody who's sick in the hospital, they just want to get their health back and get out. And if they could have prevented that, I bet you they would. No, I know that they would. There's no betting. They tell me that they would. So, I want you guys to be informed and proactive on your health journey. That's why I'm doing this. I don't want you to get swindled. I want you to take the time to educate yourself and make a decision from there. My role as a nurse is to protect my patients in the hospital. And that role extends to my functional medicine clients as well, where I'm protecting you. I see my role as protecting you from doctors who are doing completely unnecessary things, making your life more difficult, and wasting your time, money, and energy. My role is to give you back your time, your health, your energy. So to further deplete it just doesn't make any sense at all. All right, guys, that's it for this lesson. Coming up next, we have the simple and highly effective approach that creates lasting results. I'll see you there.